For most community paramedic programs, their first contact with the patient is through the 911 system. That is a very common pattern. And so a typical scenario is often that either they call 911 themselves or a family member will contact 911. And that starts the response. And the community paramedic or the EMS shows up on scene. Now, sometimes those falls they're not acute. The person isn't hurt that bad, and maybe it doesn't warrant a transport, or the person doesn't want to go to the hospital. And so we now have a fall. The EMS has that information. They have the data behind it. They know where the calls happen, and if they're tuned into it, they may be able to make that referral of someone who actually does need some other fall prevention activities, or maybe it's assistance with medications, or whatever the case might be. But because EMS is that tip of the spear, or the first contact with the patient, they can be a valuable resource in terms of identifying folks who may be at risk for falling. When a fall prevention program collaborates with the local community paramedic program, they're joining forces with folks who are experienced at going into people's homes, establishing rapport with patients. They have a wealth of clinical knowledge and expertise. And if you think about some of the fundamental components of a fall prevention program, that is assessing threats or hazards within the home and medications, those are two of the functions that community paramedics are already performing in fall prevention programs in different places today. So who better to look than someone who has been trained and able and actually enters a person's home and can tell that there are throw rugs that need to be removed or the house is in disrepair. After nearly a 30-year career in EMS, I can tell you for sure that my frustration with providing care in the field came in the form of only being able to offer the one option: transport them to an emergency department. We knew people personally, and we had no other options to offer them. And that's what community paramedicine offers to the entire system. It starts to give us options for what we can do for the patients.